We try to keep it a consistent flow and make it a peaceful environment. But the goal is really to balance a combination of structure and consistency with also some flexibility to allow for the resident to have their individual preferences and needs respected.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I will be your host for this episode. I see that what is that in the background? Is this a roll of paper towels? Okay, well, I clean my office up, but apparently I missed that one. So anyway, we have an excellent episode for you today. We're going to be talking about what it's like to live an average day in a nursing home. What time are we getting up? What time are we eating? Where are we eating? All that. But we're not having that conversation alone. We have the fantastic Irene Nobles on to walk us through the day in the life of an average nursing home resident. But first, it's time for the nursing home regulation question of the week and an opportunity for you to win a Nursing Home Abuse Podcast mug. Gene, can we throw up what the mug looks like? It's been a minute since we've showed the people what the mug looks like. It's very pretty. It's a beautiful mug. How do you win this mug, you might ask? Well, it is definitely a Gordian knot of a challenge. You're going to have to go to TikTok at Justice for Residents. You're going to click on the question of the week video. This particular question of the week video is separated from the thousands of other videos because the thumbnail is going to be the photo of the movie The Wedding Singer with Adam Sandler and Drew Barrymore. You're going to click on that thumbnail. You're going to comment your answer to the question of the week, as well as your favorite throwback romantic comedy. My favorite throwback romantic comedy is The Wedding Singer. That movie is amazing. There's quotes from that movie that I've forgotten that came from that movie. Like the other day, I was like, there were cones. I forgot that that's from that movie. But anyway, fantastic movie. So what is yours? Whatever it is, comment to it. Comment on the video. A winner will be selected randomly and announced on TikTok and our website, schenkfirm.com/podcast/giveaway. Prizes ship at the end of the month. Good luck. All right. I think that the difficulty level this week, folks, I'm going to say is easy to medium easy. I guess that would be medium. Like, is it possible to have medium easy? I don't know. We have medium hard. So it's between easy and medium. So medium easy, I guess. I don't know. It doesn't matter. Anyway, if you get it right, go to Blockbuster Video, take and rent the video cassette of The Wedding Singer and watch it tonight with your loved one. Under 42 CFR 483.24, how should a facility respond when a resident begins to lose the ability to perform daily living activities? Is it A, take steps to prevent further decline unless it's medically unavoidable, B, assume it's part of the normal aging process, or C, wait for the resident to request assistance? And that answer is A. The nursing home is required to take steps which include assessment, planning, and revision of the plan whenever the resident's ability to perform activities of daily living begins to decline. All right, so let's get into the nuts and bolts, the meat and potatoes of the episode. As I mentioned, we're going through the day in the life of a nursing home resident. I'm not doing that alone with the fantastic Irene Nobles. Irene Nobles, MSN, RN, HCRM, is a seasoned nurse executive with over 35 years in healthcare, specializing in clinical risk, regulatory compliance, and rehab nursing. Her diverse background spans behavioral health, addiction medicine, pediatrics, hospice, and trauma care. A licensed healthcare risk manager and former chief nursing officer, Irene now consults and testifies as a legal expert in medical malpractice and personal injury cases across the country, and we're so happy to have her on the show. Irene, welcome to the program.
Thank you, Rob. I'm happy to be here. It's an honor.
Great. Oh, well, an honor is a lot, but I appreciate that. So I think that we had an episode similar to this almost 10 years ago, but I wanted to but that was my former law partner that was giving the explanation, who was a CNA a long time ago in nursing homes. But I wanted to have another kind of an updated episode about kind of what is life like in a nursing home for the resident in terms of routines and such. So I'm glad that you're on to walk us through it. So kind of the first question is like just broadly, what does a typical day look like if you're a nursing home resident?
Right, right. Well, a typical day can vary, but usually starts, between 6:30 to about 8 o'clock in the morning. Caregivers are usually assisting residents with getting up, getting out of bed, personal hygiene, dressing, their activities of daily living and such. This is also the time where nurses are typically beginning to prepare and administer their morning medications. Breakfast usually follows thereafter, which is served in a main dining room area, and that's usually to encourage, social interaction with the residents. Um, some residents that require assistance from staff because perhaps they have some dexterity issues, swallowing difficulties, or cognitive impairments, they may be assigned to what we call restorative dining. And usually they're grouped together at a designated table within the main dining room, where then a staff is assigned to provide the level of assistance that they need so that they can also participate and engage in a social dining experience. And residents can also choose to have their meals served in their rooms if they desire, and that's according to their preference, and they have that right. So following breakfast, then typically residents engage in a mix of social or recreational activities, and that again is also depending on their preferences and abilities. Some may choose to have personal downtime during this time, but this is also the time where residents are getting into therapies, right? They're having physical therapy, occupational, or speech therapy sessions. And sometimes they might have a visit from the medical provider, like their physician, or an outside provider may come in and see them. And then lunch is served typically midday. And then that's followed by a plethora of varied activities or visiting time and such. This is also a time where if it's a holiday or a special occasion, perhaps there might be a social event planned during the afternoon like that. And therapy will continue into the end of day, usually between 4 and 4:30. Therapy sessions begin to taper off, and then dinner. It happens around 5. So the evening routine is a little bit more quiet in terms of social activities and such, but um, it can also be a very busy time because this is the time when residents typically like to get their showers done. They're getting ready for bed. Nursing's also giving medications again. And it also tends to be the time when new admissions are arriving to the facility. So that can make it a very busy time in the evening. And so, we try to keep it a consistent flow and make it a peaceful environment. But the goal is really to balance a combination of structure and consistency with also some flexibility to allow for the resident to have their individual preferences and needs respected.
So what about I, I imagine in my brain as it's working is that you have, let's just say the certain amount of residents on a particular wing, let's just say 15 of them. And getting up, I think you mentioned approximately 6:30 to 8:30. How is it typical? How is it typically handled if there's a particular resident that's like, I want to wake up at 9 o'clock? Is it just like, there's a thing on the wall that says, okay, Miss Johnson is different off the routine and we handle her differently? How do specific requests usually get handled?
So that's a good question. Routines in nursing homes are structured around the resident care needs, but we also try to promote autonomy and allow for that individuality of them to have preferences. So there is a daily rhythm of, meals, medication times, therapy, personal care, all of that kind of we try to have that happen consistently, to create stability and so that residents know what to expect. But that being said, we do want to encourage our residents to make independent choices about their schedule whenever possible. And so they do get to decide, what time they want to wake up, which activities they want to join, even what times of day or days they want to have their showers. And they even get to pick what they want to eat. So even though there's a particular meal being served and that there might be something they don't like, they get to make those individual choices. So Staff are really trained to look for ways to promote the residents' independence and preferences, and structure the daily routine around that, and not focus so much on, getting tasks done, but integrating their tasks into a routine that meets the residents' rights and dignity and preferences.
What kind of activities are we talking about? Like the social activities that you mentioned, like between the meals. Like, is this, how the stereotypical bingo game? Walk us through kind of what do you do with a group of individuals in this time?
Right. Well, activities can vary widely, and that just depends on facility to facility, but the focus is always going to be on engagement, right? Enjoyment, and maintaining physical and cognitive abilities of the resident population. And so facilities typically have an activities director who performs ongoing activity evaluations, and that's really intended to determine what the residents' individual preferences are for leisure and activity so that they can then tailor the offerings, around the needs and the range of interests that occur within, their resident population. And that really is important to help promote engagement, right? We don't want to just do the standard bingo if no one likes to play bingo. So ascertaining what the population is really has an interest in is important. So some examples would be like exercise classes, for example, sometimes music therapy, art projects, trivia games, um, spiritual services. They'll have chaplains come in and sometimes host things right there on the unit. And then they do group activities, like bingo. Bingo is common, but that it's not limited to that. I see a lot of movie nights, birthday celebrations are common. So facilities will often bring in entertainers also from the outside, and people will, play instruments and things like that. Therapy animals are also very popular, and themed events and such. So, you know, there are some residents that prefer quiet time and more independent activities, and so we have to keep that in mind as well. And so facilities will offer things like gardening. They'll have like maybe an indoor herb garden or an area outdoors, reading, knitting, video chatting, things like that. I've seen as opportunities for residents who like to be, independent with their activity. So really the primary purpose is just to try to promote and enhance quality of life for the resident population.
With respect to the meal times, I think that I understand you to say that if a resident elects to eat by themselves, they can do that. But if not, I'm assuming there's a cafeteria with typically with tables or like does and then once is kind of walk me through literally like what do we see, smell, hear during that period? Like, is it one person at a time as they're taken out of their rooms and go to the cafeteria, and then then once everybody's there, everybody gets a plate? Kind of walk us through typically how that's handled.
Yes. So there are residents that can get themselves to the dining room independently, and they'll do so when it's time for the meals. And then others that are maybe need some assistance with staff support, either ambulating or wheelchairs, then they are taken down to the dining room, one at a time till pretty much everyone's there. And then the meals are served tray style. Usually the cafeteria person is setting up trays. We usually try to hand out the special diets for those that maybe have some, special health related diets or alternate textured meals because they have swallowing difficulties. We tend to serve those first to that restorative dining table that I talked about earlier. And then from there, trays are individually handed out and everyone kind of sits at a family style, type of a dining experience. So as far as the nutrition goes, the dietitian, every facility has a dietitian and they have to be heavily involved and they're required to plan, balanced, appealing meals that meet the dietary needs of the residents. That is CMS requirement. So there's a menu generally that's planned. And prior to residents going down to the dining room for the day, they get menus served to them in their rooms where they get to then select what's being served that day, select the items they want. So then when they go to the dining room, the person has their menu and knows what they want, and they're served according to their preferences.
So what role does the caregiver play in the daily routine? Like I guess it would just depends from resident to resident how independent or how much assistance they need.
Right, right. Well, caregivers, to be honest with you, they're really the heart of the residents' day-to-day life. They assist, of course, with all the essential tasks, like we talked about, the ADL activities of daily living, bathing, dressing, grooming, those sorts of things. But, their role really goes far beyond that. I mean, they're also companions a lot of times to the residents. They provide emotional support. They're often advocates for their residents because they spend so much time with the resident on a day-to-day basis through providing care. They tend to build trust and familiarity with their residents, which is very beneficial in terms of recognizing subtle changes in health, for example, or mood. Um, and they often recognize it before anyone else does. And so they play a very integral role in the residents' day to day, and really they aim to ensure safety and dignity, and they kind of become like family. So we try to keep consistent caregivers with consistent residents for that reason.
You mentioned a minute ago about how sporadically there's the attending physician will be there, or perhaps therapy is there every day from a certain amount of hours. Is this something that's occurring in the resident's room? Is there typically a therapy room or a physician's room for the attending physician to go to? Kind of logistically, how does that work?
Right. Well, there is usually a therapy gym, a main therapy gym where residents will go down and participate in individual therapy sessions. They also can participate in group therapy sessions while they're in the main gym if the therapist feels that that's appropriate for them. And then there are some residents that receive therapy in their rooms for whatever reason. Maybe they don't feel like getting out of bed that day, or they are unable to get out of bed.
So tell me about typically if someone is like on dialysis or someone has to go to an optometrist appointment. Typically, how does that work?
Right. So most of the time, providers will come to the facility to see the residents. It can be a plethora of physicians, nurse practitioners, other specialists. Um, and that includes dental or podiatry typically. And then there are times where residents do go and leave the facility to an outside provider. Um, and that could be a specialist like an optometrist we mentioned, or dialysis, for example. And that's just scheduled according to the resident's need, and they're taken there either by family. Sometimes staff will assist, or they have a transport service. So um, that's common in facilities for residents.
I think that you mentioned the kind of the reassuring nature of having the same kind of group of caregivers every day or on a particular shift and group activities. What are some of the other things within that daily routine that kind of supports the social well-being or the mental well-being of the residents?
Right. Well, we certainly had to up the ante on that when we got hit with the COVID pandemic, right? And everyone was kind of on lockdown, and we saw a lot of instances of social isolation, depression, and things like that, particularly with the cognitively impaired residents. And so I think the nursing home industry really learned how to make the mental health and emotional well-being of the residents a priority. And so it's beyond just the physical health. We really learn how to incorporate the other piece of that. We do really try to encourage residents to connect, with their peers in the facility and participate in the group activities. Maintaining relationships with family is very important. If a resident doesn't have a local family that can visit, we try to assist them to get on maybe virtual calls, FaceTime, things like that. We have a social services director who usually focuses on that. She'll make visits to the rooms and visit the residents to make sure that they aren't having symptoms of depression and loneliness and isolation. Um, Many nursing homes offer behavioral counseling, and I mentioned earlier, religious services are helpful. Pet therapy is also something that's popular. Residents really seem to respond to therapy animals coming and visiting. And then there's a lot of volunteer led programs that facilities will offer. Usually staff are trained to recognize signs of loneliness and depression, and this is then allows them to create, opportunities where they can engage with the resident, which we know is so important, for emotional health. But they do also spend a lot of one-on-one time with the residents, especially those who aren't able to participate in group activities or don't want to. And so we try to keep a pulse on that, and making sure we're being cognizant of who's kind of been missing in action and who's really active in the community of the facility. Those that have memory loss are, of course, going to be a priority. And a lot of facilities have special programs to help maintain the cognitive engagement and emotional comfort that, is always going to be the goal for those resident populations. And we want them to feel valued and connected to community as well. So, really, the staff try to engage in special programs for that population.
Very well said, and that's the goal, right? So, Irene, we very, very much appreciate you coming on the show and sharing your knowledge with us.
Sure, my pleasure. I appreciate your informative podcasts, and I do enjoy watching. So thanks for having me.
Hey out there, folks. I hope that you found this episode educational. If you have an idea for, I'm just going to kick back. I don't know why I just did that on camera. Something would have dropped. Is that a button on my jacket? A button on my jacket just popped off. That's correct. It's exactly what you're thinking. I am putting on a little bit of weight, so I need to get to the gym. Anyway, if you have an idea for someone you would like for me to talk to, please let me know. If you have an idea for a topic that you'd like for me to talk about, let me know that as well. Be sure to enter the win, the Nursing Home Abuse Podcast mug, by telling us what your favorite romantic comedy is as you answer the question of the week. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.